what mental health needs is more sunlight, more candor, and more unshamed conversation. Now it's over to Nader.
Hi everyone, I'm Nadir Ibrahim and I'm here to talk to you about mental illness and the stigma surrounding it. So, pretty different from the previous topics, or just a little bit. So, let's start with identifying the concepts we're going to talk about. First, we're going to start with the mental illness. What's mental illness? Mental illness is like the commonly thought of conditions like bipolar disorder, like depression, maybe borderline personality disorder, and also intellectual disturbances like autism and also ADHD as a learning disability, and even addictions like drug addiction or maybe alcohol addictions. So, to sum it up, it's a condition that affects the brain or some areas of the brain, so it's not able to do the functions of cognition, perception, and emotion regulation properly. So, what are those three? First one is cognition. Cognition is our ability to think and learn, basically. And perception is our ability to see and hear and perceive the world in a way or another, using our senses, of course. And emotion regulation is just obvious by itself, to be able to control your emotions. That's mental illness. But about stigma is we can see stigma every day, we can experience it, we can hear stigma, but especially stigma like around mental illness is something that we experience every day in our street conversation, maybe, or social media. We always hear them, and they are resulting from stereotypes and misunderstanding, and they are putting shame on the mental illness and the mentally ill. So, to statistics, globally, 1 in every 7 teens are going to experience mental illness in their lives. And also, 43.8 millions of people are going to experience mental illness every year. So each year, this huge amount of people are experiencing mental illness. So what's the huge problem? The real problem is more than half of those people are not gonna ask for help. They are not gonna seek the help they need, and that's a huge problem because we can see the consequences of that with so many teens going to their adulthood without their proper productivity or not being able to be beneficial to their societies as they should be, actually. So why? If you got a broken leg, you go to the doctor and try to fix it, and that's all. But we don't do that when the problem is in the brain. So why waste time, and why go so late with this diagnosis? And this question is almost answered by stigma, and only stigma, because this stigma is always isolating those people with mental illness and putting pressure on them, maybe even lowering the quality of life of the mentally ill. Why? They even limit their choices of housing, choices of I don't know, employment chances, even mess up with their relationship choices. So it's pretty harsh, and it burdens the mentally ill more than the illness itself in some cases. And a very important idea is mental illness stigma is not something only in the society and outside of the patient, because every mentally ill person has been raised in a society, and this society has its stigma. and its I don't know, stereotypes about mental illness. So they start to hate themselves and maybe harm themselves. And like in the worst cases, guys, like committing suicide can be the worst case scenario. So the stigma is just accumulating, putting burdens on the mentally ill, and also putting more burdens on the healthcare community, of course. So, like, how can we stop the suffering, stop the violence, and stop the stigma? Like, first of all, guys, we gotta like treat mental illness for what it really is. How? We should see it like as a medical condition that can be treated and or even managed, and that's just the reality. Because like, come on, if you were sitting around and you saw someone choking, bleeding, or maybe in pain, you would rush to them and try to help. But we don't do that with mentally ill people. We don't do that when we see someone who is emotionally in distress, or maybe like acting strangely or intoxicated too many times. We don't do that because like we have this fear because of stigma. And that's exactly what we need to do, because we gotta be involved in the helping of others and like show concern and show compassion to be with them. Because guys, like if we as a society and as individuals start to see people with mental illness as real people and not just the diagnosis, we can break this stigma, and we can break this cycle. And and we if we could also like make peace with our own feelings, then we can try to do that. So next time when somebody of your friends just comes to you and asks, how are you feeling, or what's up, why don't you just skip the typical I'm fine and tell them how you really feel, and just be honest and comfortable with what you feel. Thank you. Thank you very much. That's all for mental illness.
Wow, that was another really important message. Thank you for sharing.
So, Poppy, you're there?
I should be, yeah. Can you hear me? Cool. So yeah, thank you so much for sharing. And last but certainly not least, we have Johnny. Johnny Beck Shematov